Hello, dear colleagues. Today, I would like to share with you our experience of providing those new service, which actually not very new. This model works in many countries, but we gain our own Ukrainian experience in this process. This process was started in 2016. There it was WHO project which in this time was made only 4 teams in Odessa, in Zaporizhia, in Slavyansk, and I don't remember where the fourth. Anyway, this project goes during the 6 months. And when he was finished, next results was received. The first is in the uncovered area different available services and needs of the population. So that's formed the individual characteristic of each of mobile teams. I remind it was a project. And it was possible to adapt the general model of community-based care to the local context. And it was important to coordinate effectiveness or operation of mobile teams, well as team could concentrate eligibility criteria, organize referral pathways, and choose full part-time staff. Was learned very huge lessons during this project. The first, it's strong and effective support of local authorities, of directors of hospitals, was extremely important for this model. Also, in that time was needed to organize a new referral pathways because the old referral pathways didn't work good for this model. And also it was a huge need to make a huge attention to work with GP and also with primary healthcare level. Also was need to cooperate with NGOs, to proactive case finding should be also accepted for the possibility of patient self-referral. Now we don't have this part of work, and also staff must be trained, and efforts should be made to decrease stigmatization and raise public awareness. It was in 2016. Then, when this project was ended, WHO continued to support one of mobile teams in Slavyansk, which worked next time from 2017 to 2020 to the next project. During this time, we tried to learn something new, to experiment with this module, to collect some data, and then in 2020, WHO start a new project. It was a few waves of new mobile teams. WHO provide trainings for new mobile teams, and now we have, as of February 2022, it's 21 teams which was trained by WHO. The next step was the providing officially as a package of National Health Service of Ukraine. So this service became official on the national level, which was a huge progress in this work. And now we have, at the February 2022, 65 teams in all the country. So mostly all the regions covered by those mobile teams. And now WHO continue to support all teams with trainings and supervision, and also WHO have in their plans training of new teams which wasn't trained before. It's example of supervision which continue in this time. And let me tell about the team, how it works. First, it's the staff which work in team. It's 4 specialists, it's psychiatrist, psychologist, social worker, and the nurse. Responsibilities of the team, it's assessment of psychological condition, it's psychological rehabilitation, advisory assistant, psychotherapy, increased social psychological adaptation of patients, social support, addressing issue of social rehabilitation, protection and support, assessment of the social functioning of the patient, and identification of social needs, organizing of conducting work with a patient aimed at improving their social adaptation, career guidance, advice on meeting professional and educational needs, organization and providing of medical and preventive care, diagnosis of mental health and behavioral disorder, it's pharmacotherapy and etc. Criteria of inclusion to the service, it's severe mental health disorders, mostly which have risk of exacerbation of mental disorder, and the presence of severe mental health disorder associated with a low propensity for treatment. And of course, it's consent of the patients. And criteria of exclusion from the service, it's a patient with disorders which associated with use of psychoactive substance and as the main diagnosis. Patients with personality disorders as the main diagnosis, patients with disorder of organic genesis, and patients with moderate and severe mental retardation. So the logic here is in these cases need another approach, so it's not about rehabilitation and socialization. Okay. On this slide, you can see service area of Slavyansk mobile team. This card was, this map was made before the 24th February, so it's north part of Donetsk region, and here you can see the borderline before the February. Actually, half of this area now occupied. It's example of work in patient's home, and also it's not the only one way. Patients also can come to the team office. Here's the example, and also this patient now in occupied territory. Okay, and here example how WHO supports mobile teams. It's photo from the our workshop which was in year before. Okay, a little bit of data. I collect some data from the work of mobile team of Slavyansk. Here you can see that for the period of October 2020 to the March 2021 was 285 visits. 24% of visits were initial, 74% was repeated, and more than 1% was final. Here you can see the number of diagnoses. So mostly it's severe depressions and schizophrenic spectrum diagnosis, so it's severe mental health disorders. Here you can see interesting data. The one of idea of those services is to cover those patients which didn't cover it by presented services. So it's outpatient psychiatric services, it's primary health care services. So as you can see, most part of patients didn't have declaration with family doctor, so they didn't receive service on primary health care level. And also most of them didn't visit regularly outpatient psychiatric services. And also it's a problem with employment of those patients. You can see most of them unemployed. And another interesting thing, how works this service, you can see that pharmacotherapy cover only 30% of all services which was rendered during this half year. And most part, it's 44%, it's psychosocial support. And also we have a huge number of another services like psychosocial intervention with the family of the patients, like social services, etc. So it's not only about psychiatric support, it's not only about drugs, it's not only about medical approach, biological approach, so it's biopsychosocial approach. And most of visits was in patient's home. Only 39% was in the office of the team, and some of visits, it's 7% was on another place in community, and only 3% was on the base of another hospitals. Well, what the advantage we have? It's providing at the patient's home its possibility to go to hard-rich areas. I didn't include it to the presentation, but our territory, which covered by our team, mostly rural. So sometimes place where patients live, it's 40, 50 kilometers from our office. So it sometimes become difficult to get for patients to get to the office. It's confidentiality. It's by psychosocial approach, as I told, and also it's work with patients, relatives and environment. It's prevention of hospitalization, of disability, it's active interaction with medical and social institutions, it's high flexibility of those teams. The challenges which we have now, it's lack of legal framework, lack of documentation developed special for the mobile teams, and lack of indicators suitable for assessing team productivity. I mean, these indicators on government level, so when WHO supports a team, when WHO works with team, they have a lot of indicators, they receive a lot of data, but on the national level, I think we need to improve this stage. And opportunities which we have, it's wide field for research, it's opportunity to introduce modern mental health approaches and develop new ones. And promoting mental health and removing barriers. Thank you.